In this video, we'll explain the condition frozen shoulder. Frozen shoulder is a common condition that affects women more than men and often affects people from the age of 40 to 65. Frozen shoulder usually has no obvious cause, and patients can experience pain with progressive stiffness. Patients notice initially difficulty reaching out to the side or reaching behind their back, and eventually as stiffness progresses, they're unable to lift their arm. Frozen shoulder is very painful at night, and patients often have difficulty sleeping. We used to tell patients that a frozen shoulder will get better on its own within 2 years, but we now know from Scandinavian studies that up to 7 years after diagnosis, patients still struggle with their shoulder. The first line of treatment of frozen shoulder is a steroid injection into the shoulder joint. This helps settle the inflammation inside the joint and helps to improve the pain. This is followed by a stretching exercise program which can be done at home, and we do this for 2 months after the steroid injection. Once range of motion starts to improve, we then start physiotherapy with a rotator cuff strengthening exercise program, which needs to be done for 12 weeks. And as we strengthen the shoulder, patients often note that they get more range of motion. In some patients, this first line of treatment doesn't work, and they remain with either pain or ongoing stiffness. In these cases, we often discuss surgery. Surgery for frozen shoulder is done in the form of a keyhole operation called an arthroscopic capsular release. During this procedure, we use arthroscopic tools to cut out the scar tissue inside the joint that is restricting movement. We then do a manipulation and add steroid at the end of the procedure. After an arthroscopic subacromial decompression, a patient will then need aggressive physiotherapy within a couple days of the operation, and usually they recover within 3 months. Thanks for watching this video.